Hi, Mayor Colberg here. I just actually asked Dr. Ram if he could help me out because I have a few questions, Dr. Ram, and these are coming to me, so you know way more than I do. So I get the question is, how do we look after somebody, who's got COVID-19? What are some of the steps? For example, how can you help me so I can share?
No, absolutely. And of course, I know that the town has provided a lot of information, and it's been based on all of the reputable sources like CDC and some public health agencies, which I have here. And I printed this stuff on purpose because even in healthcare, when things are tough and things are going bad, we place in, let's say, the trauma rooms, the exact way for us to do a resuscitation. It's in the room because when it's that kind of high stress situation, you forget.
Well, yeah, because when you're going through this isn't normal.
Exactly, and it's not going to be normal for any family, any loved ones. It's going to be taking care of anyone. So the first thing is, I know the town has a lot of great resources, and there's ability to get even how to hand wash, which is what this one is right here.
Okay. I watched a video today of a hand wash.
Oh, that's perfect.
Oh my goodness.
It's definitely more involved than you think.
Yeah.
So you can imagine in the high stress situation where one of your loved ones has been diagnosed and they're at home because they're in the mild category, meaning they don't need any of that breathing support. It's going to be stressful, and you might forget. So this is treat it like you're at school.
So people should post this on.
I would post that where you're going to be doing your hand washing, both for you, the caregiver, but also for your patient, because in this scenario, they're your patient. Not mine.
What happens if, like for example, do they have to have special cleaning, or can they just use, like I see you have sunlight here, can we just use normal sunlight?
Absolutely. So you're home, soap is king. Even in a lot of scenarios where we would say, you know what, soap is even better than any kind of hand sanitizing and things you're going to do. And you can use it for everything. So you can use it for your hands, you can use it for cleaning the bathroom afterwards, cleaning surfaces. Of course, it's going to leave that residue, but you know what, if we're coming between, am I comfortable, am I safe, do I think it's clean? I'm going to go with the clean residue than trying to do something else.
So another big question for me gets, what about gloves? Like not
Yes.
People don't have access to gloves, and what's another option?
So first, number one option is always going to be wash your hands, wash your hands, wash your hands. No matter what, whether you have gloves on or not, even if you have gloves, we're telling people you have to wash your hands right after with the same technique. So by and all, that's it. In a pinch, if you're worried, if they get sick and they vomit and all that kind of stuff, so now we're talking about bodily fluids. In a pinch, if you have a plastic bag and you check to make sure that there's no holes in it so that you're not running into that scenario, you are able to just wrap it around a few times, and then you put the little thumb through, and you actually have it made into a makeshift glove.
Oh, that's
and this you're not going to be doing industrial cleaning with this stuff.
No.
You might be grabbing things, doing stuff. That gives you a little bit more peace of mind. Again, there's no holes, and again, always, you're going to be washing your hands the exact same way.
Clean. So we need to make sure that they all have their own towels, their own plates, their own cups. Can that all be washed with? Like, can they throw it in the dishwasher? Can they throw the towels in the laundry, or does everything have to be separated?
At this point in time, and I just checked right before this today to make sure the most up-to-date information, both the CDC and any of the public health agencies right now have zero recommendations that anyone that has COVID-19 needs to have all of their stuff separated. So that includes, you grab their plate and cup from them, you throw it in the dishwasher, off it goes. You grab their clothing, their bedding, their towels. It can all be cohabitated in the same washer, all that's fine. Changes a little bit if there's that bodily fluid, but we talked about you use the gloves, you're going to be careful, but even in that sense, everything can still be washed all together.
Okay, so what again, a question is, people are saying, so if you talk about isolating, what if they have two rooms, separate, keep distance, they have to basically stay in their room, is that correct?
That's correct, yeah. I mean, the gold standard, and this isn't a practical thing for the entire world, obviously, but the gold standard is they'll have their own separate bathroom, they'll have their own separate bedroom, and when we say separate, it's not separated by a sheet, ideally, separated by a wall and a door, and they will stay there for that 14 days entirely, and everyone else will be on the other side, if that's possible.
So there's a good example, because a lot of people can probably separate rooms, but not every house has two bathrooms. So how do we how do we encourage that? Or is it just really enforcing when they leave that room, go into extreme clean, and then every time they come out, extreme clean again?
Yeah, you're absolutely right. So we call it it's the 2-hit method. So even now, anybody, you, if I'm going into a scenario where it's in a public space, then we're going to be cleaning. I will clean whatever I'm using when I go in, and I will clean what I'm using when I'm going out. It's the same principle as they use at every gym across North America. You're supposed to clean your equipment before you use it, clean it right after. So right there, this isn't uncharted territory for that kind of feeling and thoughts. For the bathroom though, absolutely right. It's going to be really hard because a lot of places don't have one bathroom per every individual. So I'd probably say, again, we would go back to, you have whatever cleaner you have. If you don't have anything special, you use your sunlight, and I can actually show you. You can just do some cleaning while you're there.
Yep,
the person that can do it, that has their COVID-19, and then other family members.
People need to see this.
And of course, we'll keep our social distance as we walk down this hallway. It is going to be with the light here on the left. I'll pass through you.
Okay.
And so here we are. So, and down. Like I said, if you had cleaning products, you could use the cleaning products. But if not, all it takes, you just take some of your soap that's in there. You're gonna put some in there. Now remember, this soap obviously would stay in this location now. It's not gonna leave here because we're talking about taking care of someone that has COVID. So you're just gonna get it nice and soapy, and you may even be using this to clean your hands anyway, so just make it nice and soapy. And there's your cleaning product, your cleaning solution. And
so that's the thing, is you don't need special cleaning products. You just need to use your good old-fashioned dish soap and wipe everything down.
Absolutely correct. Now, of course, the town's going above and beyond this because we're talking about many numbers of people that are going to be using things over a great period of time. Here, we're talking about, as we said, one contact in and out.
Yeah.
One contact in and out. If you're going to use a towel, then know you're going to be washing this more frequently than you would expect. That's why, as we know, paper towels are king right now. So you can use your paper towel. You can put some in here, and you're going to just be cleaning all the contacts that you know that you probably think you've touched, as well as the ones that you probably didn't. And as I said, you're going to be leaving a film on there, but I would rather have a film than anything else. And for everyone that's flown, you know that in every bathroom and every plane, they say,
clean, clean, clean.
And they say, clean out your basin, wipe off the counter here of everywhere that you would have used.
Well, that's the thing. This isn't a phenomenon to start cleaning, but what we're trying to stress to people is to it's time to go over and above the cleaning. Like really just be safe.
And some of the things people forget is the light switches and the doorknobs. These are probably the big ones. We usually are pretty good at picking the rest of the stuff, but it's probably the ones people forget.
Well, thank you for inviting me into your home and allowing me to ask a few questions. I'm sorry to put you on the spot on some of them, but it's really important that the people in our community realize we want to protect them. That's what we're doing here. It's all about protection.
And these are all great questions because, I mean, it's going to come. There's going to be people affected, and you don't want them scrambling. No. You want them to have the resources.
No, so thank you, Dr. Ram, for everything you've done for the community, for us. You're helping our town. We just want to look after our community. We want you to be safe. We want to protect you. So any advice, just clean, clean, clean. Get out there, enjoy the fresh air. Thanks for your time, and take care, everyone.